Hey, everybody, and welcome back. It is a new year. It is 2024. And the last time you saw myself and my special guest today, Karen Ross, was the 100th show right before the Thanksgiving holiday, live from Chicago's Doubletree Hotel. And what I have is a lot of interesting news for all of you tonight. One key issue is that Karen Ross will be with me at the first show of every month starting from today. Why? Perfectly titled episode is called New Beginnings for 2024. And one such new beginning is having a beginning of the month review. We all have talked about various healthcare months. If you recall, last February 2023, I had a 3 episode celebration on cardiac care. Now, that's not going to be the case next year, or rather, next month. In February 2024, we are going to go over cardiac care, and we will bring back special guest Retha Gray, who has been an expert in the cardiac issues, but it'll only be 1 episode, and it'll be tailor-made, and even more so, it will be live from the Hilton. Now, that's another new beginning. Frank About Health for the month of January is going through some logistical changes, but for a good reason. Between February and the rest of this year, most, not all, but most of our shows will be broadcast from a Hilton, whether it's in the New York area, or whether it's in Chicago, or whether it's in LA, or whether it's in Seattle, or whether it is wherever. The hot topic that we will discuss on the episode is focus, whether the guest is there. I'd like to be more in the room, just like Karen and I were. So we're going to spend the next hour talking about not just where we've been during the 100 episodes, but the reason why, due to our new level of reach to all of you out there on YouTube, Facebook, Twitch, as well as our LinkedIn channel, and not to mention, of course, TalkRadio.ny, we ultimately want to be streamed at Hilton. And that is something in negotiation at this time. So, for this reason, we want to really reach out to all of you during this campaign year, but mainly to keep the vigilance and the focus and the activity on the mental health and physical health issues that we all strive to find solutions for and to continue to advocate for. As I've been saying for the last 2 years, Frank About Health is a show about providing insight into your own healthcare issues, and that you have the power to find the best solutions possible, of course, with the right professional guides, as well as colleagues or friends or family members that are all in the best interest of giving you your best quality of life. We're going to spend the hour with Karen reviewing some of what we talked about at our 100th show, but also highlighting what she has been doing with Karen Ross now and her hypnosis therapy, which for me, it's working leaps and bounds. And we'll talk about that more during the show. But we want to also highlight some other interesting shows that will be coming up where she will have an ability to show if hypnosis is an alternative treatment for whether it is a neurological or a mental health issue. But there's also other exciting things. We will continue our monthly segment on stages of epilepsy. Next week, Stages of Epilepsy with Jeff Dimitrak will feature a host who has her own epilepsy podcast. Sound familiar? Well, this time I'm going to share the wealth and let her talk about her podcast and her special case, which also have genetic and hormonal issues in play. So that should be an interesting topic. And then we'll talk about more of what's going to happen throughout the year. But I wanted to welcome you all back, all the listeners that have been with me since day one in May of 2021, when we were in the world of COVID. And now we are in the world of future advocacy for all of us. Sound like my commercial, right? Well, either way, I'm not going to issue so much of a disclaimer. I'm just going to say that this is a show with information for all of you. If you don't agree with it, that's fine. And if you do, then you can always reach out to myself or to Karen. There's frankrharrison1@gmail.com. And Karen, I think your info at karenrossnow.com.
Perfect.
Right?
That's it. Yes.
But we are trying to make everyone engaged in our conversation over the next hour and beyond. And we want all of you to interact with us. That is really how we are advocating for each other. So now that I've given all of that introduction over the last 5 minutes, Karen, I want to welcome you back And I want to welcome you to our collaborating together over the next 12 months, especially.
Well, thank you. And I'm honored to have received that invitation, and I look forward to it. I think we've got some really great plans going forward. And I loved what you said a few moments ago that we're going to talk more and more about people advocating for their own health.
Yes,
And depending on what they're dealing with, having the right professional guidance is very important. Um, I obviously think hypnosis can, well, I know that it can play a really pivotal role in people's lives when they're dealing with physical and emotional and mental issues. And what you alluded to, and what I really try to educate people about, is the fact that hypnosis is you learning to use your subconscious mind. So many people still have a misconception about hypnosis, and some of the things people are afraid of is that they're going to lose control, that they're going to get stuck in a trance, and things like that. And that is not hypnosis.
right.
Hypnosis is simply being guided by a professional. I'm a board certified hypnotherapist, and I guide an individual to just kind of quiet their conscious mind and access their subconscious mind, which just
Yes,
has incredible power, not
yes,
only to make change in someone's life, but to reveal information that will assist in making those changes. So
absolutely.
that's a real broad description of hypnosis, but I hope it just clicks some curiosity in people to at least want to explore it a little bit further, because some of the results that people experience seem miraculous. I mean, I've
Yes.
seen people do away with chronic pain. Uh, we certainly use it for the issues people typically link to hypnosis, like becoming a non-smoker, losing or gaining weight, sleeping
Right.
better, things like that. Um, and I've seen people make just 360 changes. And if we don't make that complete change or completely get rid of a situation, we transform it, or we
Yes.
change we help the person change their perception about it. So that that in itself can be a game changer.
Oh, and I could tell you honestly, you were on my show initially back in, I think it was early October.
Sounds right.
And
Yes.
right, and we had a session together shortly thereafter, I think about a week later, and I have to tell you, I literally believe in everything you've just said, not just what you said on the show, but what you've just said a few moments ago, because all of the things that I have been experiencing throughout the holiday time, even the story of my father's cancer, it is now the tumor has shrunk to a level less than a nickel, and it
Wow.
for the indication on the PSA Gleason score, which is what a lot of prostate cancer or prostate oncologists look at, is that in order for you to be healthy with prostate cancer, your score has to be between 2 and 3. The healthy male is 0 to 4.
Hmm.
All right. My father is at 2.2 as of last
Wow.
Tuesday, the
That's
lowest he's
amazing.
ever been. And I'm not saying that your hypnotherapy had helped his cancer. I
And
would
I
like to
don't want to give
say,
that impression
right,
either.
right, right. But what I am saying is that my perspective on it had been more positive rather than the dread. Why does he have 2.2? Why is it not 0? That would be an
Wonderful.
example of looking at the glass half full. Or, like what I was mentioning to you earlier, the positive rewards, I should call them, that I've received from Hilton to get their sponsorship and their openness for me to talk about every aspect of Hilton, free license. I mean, that was just in a conversation and they awarded it to me. I didn't even expect it, but it was the way I was communicating to these people because I listened to the audio tape you've made for me and realized that everything negative just needs to be dismissed when I'm focusing on my future objectives or
That's
whether I'm
right.
focusing on my mission, which is healthcare and frank about health and everything I'm trying to do to continue advocating. I called it the veracity, always
Ah,
looking for the truth,
yeah,
right?
yeah,
And well,
definitely.
frank also means true, but I'm basically trying to say, uh, just thinking that way, it has been a lot due to your support. So for that reason, I want to just be, I guess you could say, a testimonial for
Well,
all
thank you.
future. Oh, you're very welcome. For any other listeners out there that are interested in contacting Karen, remember her website is right there in front of you right now, KarenRossNow.com. I will show you the website during the commercial break, the first break that we take, so that way you can get more information on what she can possibly do to help all of you out there, because a lot of it is mindset. Even though we all have struggles from whatever they may be, it's in the way you look at it that could possibly even move mountains and treating it faster. So that's something I
Definitely.
truly believe in.
Yeah. It's always worth a conversation. You can
Exactly.
decide at the end of the conversation, no, that's not for me. But most people want to proceed and at least give it a try. So,
Exactly.
yeah.
Now, I mean, I guess if anything, though, um, being a hypnotherapist, as long as you have been, I guess, what, 5 years, 10 years? How
Yeah,
long
I
has it
was
been?
doing personal coaching before that, and then I
Right.
incorporated the hypnotherapy just about 5 years ago. And it is a game changer. There's no question about it. It just makes a tremendous difference. Um it speeds things up, number one. We can always make change. We always
Right.
have that ability. And with guidance, we can make it more quickly than on our own. But
Right.
it factor in hypnosis, we can speed that up dramatically, dramatically.
Yes. But would you say that a lot of your work has been predominantly focused on those that have been dealing with mental issues or mental health issues?
Not
Or
necessarily, not necessarily.
okay,
Many, yes, because I think what you've alluded to and what we worked on was just helping you reach another level of excellence, if you will.
yes, yes,
But I have, and that's extremely valuable. But I've had a lot of people come to me with chronic pain, and
mm,
again, the subconscious mind factors into it, and attitude and perception and so on and so forth certainly
yes,
factors into it. But the issue that the people bring to me is chronic pain, and it's real to them. I mean, they're feeling it in their body, no question. Um,
yes,
but one of the things they learn is that the focus on the pain perpetuates the pain. And
exactly,
so I help people. That's another thing I like people to know. If they feel like someone else in hypnosis is taking control of their mind, I teach people self hypnosis. So they're controlling their own mind. And
yeah,
for people who are really worried about that control issue, that usually allays their fears, knowing that they can learn to do it themselves.
right,
Having the guidance of a professional obviously is the best way and the quickest way. But in the process, if you can learn self hypnosis, it's terrific. Just a real quick example. I think we've all heard, whether we're into sports or not, but we've heard stories about championship athletes or um, team members, football, basketball, whatever, kind of taking a few minutes where they just sit very, very quietly, close their eyes, and you might wonder what they're doing. Well, what they're doing is they are going into trance,
right,
picturing their success on the field or
exactly.
on the court. That's what they're doing. It's self hypnosis. And
No,
yeah,
no,
if we
no,
just need to learn that and we use it all the time, whether we want
exactly,
to or not. We're in a different trance so many times during the day. And
yes.
what we have to do is learn to use those to our benefit.
And now we have to take a 30-second to 2-minute trance. So
Okay.
I'm sorry if I seemed a little abrupt
No,
right there, but
no, that's fine. That's fine.
was a perfect segue. So,
Good.
ladies and gentlemen, please stay tuned as we are talking about what's new in 2024. We're taking new directions with Frank about health and beyond. And we will be back in a few right here on TalkRadio.nyc, YouTube, LinkedIn, Twitch, and Facebook. We'll be back. See you soon.
Are you a conscious co creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour Awakening Humanity, Thursdays 12 noon on TalkRadio.ny.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on TalkRadio.ny at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on TalkRadio.ny.
Are you a business owner? Do you want to be a business owner? Do you work with business owners? Hi, I'm Stephen Fry, your small and medium-sized business or SMB guy, and I'm the host of the new show, Always Friday. While I love to have fun on my show, we take those Friday feelings of freedom and clarity to discuss popular topics on the minds of SMBs today. Please join me and my various special guests on Friday at 11 a.m. on TalkRadio.ny.
You're listening to Talk Radio NYC. Uplift, educate, empower.
Hey, everybody, and welcome back. Now, since everybody has seen, hopefully, those that are out there still watching Frank About Health since day one, you have seen me cover, obviously, COVID. That was a big issue. We've had special months, like we had the Cardiac Awareness Month in February of 23. We had Mental Health Awareness Month in October, I think part of September as well. We've tried to figure out ways of epilepsy with Jeff Dimitrak and our segment that we run on stages of epilepsy, but we haven't been consistent. And I think now, especially in 2024, we're dealing with a lot of uncertainty in our world, including our presidential election year. And again, I stay away from the politics, but one major driver of any political group or society is health, physical, mental, alternative, whatever kind of healthcare issue that is on a lot of the constituents' minds. So I decided with Karen that starting really February, we're going to take a look at each month, whatever the hottest topic is, and focus on it. Plus, give some time for the other subsets that are being developed or promoted or communicated about in the media, so that we can bring full awareness and set the agenda for the types of shows that we will have each month right here on Frank About Health. So I want to now open the floor to you, Karen, and explain to the viewers and listeners why we came up with this or what research you had done to show that we really have a lot of substance that we can share with the audience over the next 12 months.
Well, and to truly share that substance, we'd have to be on every day.
True.
I was amazed when I set out to find out just what conditions or diseases or whatever are given special recognition in a particular month. And I came up with these long, long lists. And so you and I will have to really give some thought as to which ones do we really pay attention to. And some of them certainly are more prominent than others. But as you said, we'll start out in February. And a couple of the areas, and I think you mentioned this, that February is the American Heart Month. And so we'll definitely give some attention to that. And one of the things that I hope to bring to the table is most, if not almost all of the research has been done on men. And heart disease, heart attacks manifest very, very differently for women. And I think it's important that we talk about that because I have heard that while we certainly place breast cancer very high on the risk calendar schedule for women, heart disease exceeds that, and we don't talk about it that much specifically for women. So I can guarantee we'll get into that a little bit. So there are lots
Absolutely.
of things we can cover in that, and you've already got some things on the schedule. Now, March is National Kidney Month. Have you ever had a kidney stone? I have. It's been a
Oh,
long
wow.
time.
So that would be interesting to learn about because thankfully, knock on wood, I have not. I've heard of the painful
Yeah,
uh,
it's
issues surrounding
yeah,
it.
yeah. Thankfully, it's been many years for me, but nevertheless, there's a lot to learn about the kidneys. It's also
Yeah.
National Nutrition Month. I think we're all learning more and more about how we should be eating. So we'll probably touch on that. And Save Your Vision Month, I'd say that's pretty important. What do we need
Yes.
to pay attention to in that regard? Then when we get into April, the list was 2 pages long. So we've got lots to talk about in April.
Right.
Parkinson's Awareness Month. That Parkinson's has become more widely recognized because of Matthew J. Fox and
Right.
other famous people who have been stricken by Parkinson's. So we'll
Right.
learn something about that. I know in the past I've been involved with child abuse prevention in April. Well, that
Mm.
factors into addictions and mental illness and all kinds of things can factor into the backstory of how a child can get caught in an abusive situation. There are so
Right.
many things to talk about in April. Um, oh gosh, in May, better hearing, better vision. Vision comes up again.
Yeah.
Arthritis, it's National Arthritis Awareness Month. Again,
No.
May was 2 pages of different conditions. Um, June, Alzheimer's and Brain Awareness Month. Talk
Right.
about a critical issue that we all need to know more about.
I've
Cataract.
been dealing with that
I
personally
know
for the
you have.
last 6 months, especially. So I can definitely imagine what kind of conversation we'll have in that time frame.
Yeah. Now, I have a friend whose husband was just diagnosed, and you can already see the change not only in him but the dynamics of their relationship, and it changes everything. It
Right.
changes work schedules, it changes shopping, it changes just about everything in someone's day,
Yes.
and you definitely will be able to share a lot of good information in that regard. When we get
Yes.
into July, there's not that much in July, actually. Um, but then we move to August and we get kind of busy again. And going toward the end of the year, September, all kinds of things begin. There must be something about kind of laying back for the summer and not maybe,
Vacation.
yeah. And well, and the organizations that foster some of this activity, they're not
Yes.
as busy in the summer. But then
Right.
September, I got back to 2 pages full of things to be looking at. September is Healthy Aging Month. Well, who's not thinking about that? I mean, we
Oh,
all should be, but
yes.
the older we get, the more we pay attention to it. It's
Yes.
also, this was kind of interesting. I don't know how much time we want to spend on this, but we can take a look at it. Gene Therapy and Specialty Pharmacy Awareness Month.
Wow.
I think there is a lot more information out there about gene therapy.
Well, in fact, I've had some shows in the past where we've had James Swanson come in and talk about CRISPR, which is a gene therapy technique to help things with people like with
Yes,
epilepsy, or even remove whatever genetic chromosome could lead to things like Parkinson's. Maybe he would be a good guest to appear during that month, for example, or even
absolutely.
some of the other guests that have been on the show. You mentioned nutrition. I'm thinking Evan Messman, who
Yes,
just did his episode on think eat with your brain and not your stomach, diet of the mind. So yeah, I could see how we could really take advantage of those particular months and actually dedicate an episode to the nature of the month, but then probably during the month have that guest appear and we could continue discussion with them on the particular issues that are going on.
right.
That sounds interesting.
And I think what I've learned looking at these lists is the crossover. You know, how you can be talking about one thing and then you find that another aspect that factors into either the seriousness of that condition or the cure of the condition carries us over into another subject, like you mentioned, nutrition. And I think we're becoming much more aware of how, in fact, there's a show on Netflix right now. I think it's called You Are What You Eat, the twin experiment, where they have taken, I don't know, 6 or 8 identical twins, and each one gets a different diet. And at the end of 8 weeks, they're going to show the difference that this has impacted mentally, emotionally, physically, what the two have. So they come to the table with the same DNA, but they get a different diet. And that's really going to prove a lot to us, I think.
Oh, absolutely. What can you name the show again?
I'm pretty sure it's You Are What You Eat. I can double check during the next break, but I'm pretty sure it's You Are What You Eat, the twin experiment. But I'll double check and be sure that after our next break, I'll tell you exactly what it is.
Okay, awesome.
Okay. But I guess the point is we've got a lot to talk about this year.
Yes. Yes. And also, we want to bring the whole picture into it. Like you said, we talk about the symptoms, the causes, the treatments, the cures, the alternative treatments, where it may fit with hypnosis, for example, where it may fit with just your mindset. I guess even just in general, any new research that comes out during this year. I'm sure there's ongoing research by all of these organizations that are sponsoring these months.
Sure.
This is like your chance to deliver to the public whatever message they want to communicate, especially as we get closer to election season. I'm sure that's why things look very busy in September.
Yeah, I guess. So get everybody's mind off.
Yes, that's part of it.
Yeah.
That might be part of it. But we're about to take our second break.
Okay, go right ahead. And I'll double check the name of that show.
Oh, okay. Exactly. So, ladies and gentlemen, please stay tuned right here on Frank About Health, and we will be back right here on TalkRadio.nyc, Facebook, Twitch, LinkedIn, and YouTube. And we'll see you in a few.
Hey, everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on TalkRadio.nyc, I host a program, Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on TalkRadio.nyc.
What really drives success in business? Introducing Intangify, the show that explores the intangible assets that create value and growth. I'm Matthew Aspel, your host and an attorney focused on innovation. Join me Fridays at noon Eastern to discover how innovation, culture, and other intangibles shape thriving companies from startups to established businesses. We'll share strategies to unleash your business's true potential. Tune in live on TalkRadio.nyc Fridays at noon Eastern and Intangify your business today.
Were you an essential worker during the pandemic? If you needed to learn stages of epilepsy, did you depend on advocates? Did you use new innovations to cope with mental and neurological issues? Maintaining high quality of life and keeping good mental health are what we all strive for. I'm Frank R. Harrison, host of Frank About Health, and each week top healthcare influencers, professionals, and innovators answer these questions and more. Stay tuned on Thursdays at 5 p.m. on TalkRadio.nyc, and I will continue to be frank about health with all of you.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Hey, everybody, and welcome back. Right there, you've heard in the last segment about what our slate of shows is going to look like based on the quality of the months that we are talking about, discussing, celebrating, advocating for, so forth and so on. Overall, all of us are always concerned about our health first. And we are concerned about our other plans and our other dreams and our other goals and our businesses and our families and our friends and everything else. But you can't do any of that unless you really have a consistency with your own health. That's the message I have been trying to swing home for over 100 episodes now. And now with Karen's involvement in the first episode of each month, that we will make sure we swing that message home even harder this year. 2024 is what I'm designating the year of new beginnings. As I said, in 2023, the future is healthier, and it became healthier. So a lot of mandates get lifted, although in certain cities right now, it's been restricted again because of an outbreak of RSV and COVID and other things. But all of us, or most of us, I should say, are vaccinated. So the likeliness of us being in the hospital or worse is much more slimmer now than it was 3 years ago. But what we can also learn from that experience going into the future is, again, we are in charge. Remember that. And I will continue to repeat that on every episode if I have to. But at the same time, it's just a matter of understanding that everyone, it does take a village. Everyone is in charge of their health care, their decisions, their treatments, and everything else. But you need your team, not just the family and friends, but you need your doctors, your specific specialists, your mental health professionals, alternative healers, so forth and so on. So if you look in that view, that we're all in this together, we can have that positive outlook that we spoke about in the beginning of the show. I think for this third segment, though, Karen, do you think that we should reflect on what we've talked about in the past in various episodes, or do you have other suggestions or insights that maybe we haven't even discussed yet? I want to make this like the potluck segment.
No, I think that sounds great. I'll just make two real quick points. First of all, I will confirm that the name of that Netflix show is You Are What You Eat, a twin experiment. So if anybody's curious about it.
Right.
I just started watching it myself, so I don't know results yet. But something you mentioned a moment ago, I think you used the word holistic, and gathering around us all of the specialists that we need. I met with a potential client the other day who has actually quite a few physical issues. But what I learned was that she's gone to all different doctors for different things and gotten different medications, and nobody's overseeing the whole person. And so that's what I think is so important, is having someone who is overseeing everything we're doing and giving us some good guidance so that we know to reach out and find the right people for the right thing, but to know that they're either communicating with our other practitioners or, we're somehow keeping track of what everybody's doing for us and not just blindly doing what might be suggested. Would you agree with that?
Oh, absolutely. I mean, I'm just self-reflecting on, because I found myself being an overseer of multiple individuals in 2023. From my father, I mentioned the cancer.
Mm-hmm.
I had my cousin with the Alzheimer's. Well, it didn't begin that way. It began with just taking care of her heart condition and her eye surgery she was going through. But she ended up developing, early onset Alzheimer's in 2022, the summer of that year.
Mm.
And it just got worse over the last 3 months. And then at the same time, last April, I had to actually take a 2-week hiatus from the show because I had to fly out to LA to take care of a friend of mine who was going in for, I think you could say, it was an orthopedic surgeon that had to, she broke her leg in 3 places and she needed to have rods installed. There was no family alive to advocate for her. He had me come out there, and I met with the doctors, the surgeon, the rehab center, talked with the, what do they call that? Workman's compensation people, even though that's the state of California. And I only understand how New York runs things, but I was able to be a go-between, a bridge. And as such, I became a proxy just for the duration of her surgery. And then after she was in rehab, all I was someone to talk to as not next of kin, but point of contact. point of
Right.
resource.
Right.
So in indirectly, I became an overseer with different illnesses. And what kept me balanced, ironically, was this show. So I
I
can understand the importance of having an overseer. I know Phyllis Quinlan, who was also my co-host a couple of years ago. We had a special episode on an organization called Share the Care, and it was a 2-hour episode back in 2021.
Mhm.
And we were talking about how the Share the Care organization with Sheila Warnock, who Phyllis works closely with, was incorporating teams of people that would be there for the patient, especially if, let's say, they were a dementia patient or they were a senior that was having their quality of their care at home rather than in a home, in their own personal home. And they would rotate. The team would rotate and come in. One would do shopping, one would do laundry, one would take her out for walking or playing or engaging with others. That doesn't work in all cases, but it has the same mindset, the importance of an overseer or a team that keeps things holistic, because especially when you're talking about elder care, you're not looking at just symptoms anymore. You're really talking about palliative care, if that's the
Mhm.
case. Or
Right.
you're talking about how are we going to make the quality of life of this individual, even though it's now less than it was when they were younger, but a little better than it is when they're by themselves. You know,
Well, and you know what else is important, Frank? And I have a couple of friends that we have agreed to do this with and for each other. When we have
Mhm.
a doctor's appointment, maybe not just a run of the mill follow up, but something that's looking into a particular condition, we take a friend with us. And
Yes,
it's just to have, I know I mentioned it to one friend. She said, I don't need anybody to go with me. I said, I know you don't need it, but it doesn't hurt to have a second set of ears hearing what goes on. And
exactly.
especially if you're the patient and maybe you are getting some news that that in, it isn't that great. Um, a part of your brain kind of shuts off for a few minutes,
Yes,
and a part of your brain can even go into shock, depending on what the diagnosis is. So to
correct.
have somebody else there potentially making notes, I always hand my friend a pen and a notebook. Jot these things down as you hear things. Or if you think of a question that I'm not thinking of, butt in and ask that question. So I think everybody would benefit. I don't care how old you are. Take
Right,
somebody to the doctor with you just to
right.
hear what's going on.
Right. It could be a trusted friend, it could be your
Yeah.
healthcare proxy or both. But at the same time, like what I've had to discover, even just living my life with epilepsy, is that epilepsy commingled with COVID at the time, or
Mm,
commingled with any other. I was once considered pre-diabetic. Thankfully, that's no longer the case. But they're not saying that there is a relation between the two disorders. But when epilepsy, a non tangible illness, there's no tumor, it's all brainwave electricity,
right.
is something you have to monitor with medications and visits and x-rays and MRIs and all these other things. You learn a pattern that, okay, now I'm checking for an actual broken bone, or now I'm doing my annual physical, or now when we were all doing vaccines, those who were doing vaccines, simultaneously, if you have diabetes or pre-diabetes, what nutritionist are you now going to add to your team? It became organic for me. I was working with a team of doctors since I was, well, without giving away my age, let's just say 50% of the time ago. Let's say the last 35 years.
Okay.
35 years. All right. So the thing is that in terms of developing it naturally, just the idea of giving that message to others just became a natural tendency. And just if people can understand that you're not having to go through legal channels to build the team, you just develop a small cohesive network of individuals and treat, especially when you're younger and you still have most of your faculties, start getting yourself ready to build that team for when the time is really needed.
Right.
You know,
Exactly. Yeah.
people have to be forward thinking about healthcare, and it's a
Right.
shame that that's like one of the last things most people seem to think about.
Unfortunately. Unfortunately.
Yeah.
But I think that shows like yours, and
Yes.
fortunately, I think other people who have a voice that people listen to are gradually shifting that, and people are starting to pay more attention.
Well, and I can definitely echo what you just said, where a company like Hilton came involved to begin with. Um, Hilton in New York City alone, because I don't know about the other cities during COVID, but they turned most of their high level brands into essential worker homes, as well as places to just take people who were sick and wanted to be safe from their families from infecting them. And I didn't understand it. I was grateful for it because I certainly had to use Hilton to stay away from my father when I got COVID. But in the experience that I had, and we shared this on the 100th show, I learned that Hilton as a community, the brand, is really coming from the nature of Conrad Hilton, who founded it. I think it was over 100 years ago. Yeah, it could have been the early 1900s. But the thing is that his focus was community, family. We all relate to each other. We're not just travelers. We're not just tourists. We are human beings that are learning to live with each other in temporary locations, the whole nature of the hotel business. And I guess that philosophy just trickled down into the way that during a health crisis like COVID, they wanted to live their story. And that's such, I just thought it was a perfect fit to really be involved with in terms of producing and especially in the longer term, producing this show and doing what I can to really emphasize the value of advocacy through a credible brand like Hilton, because we're sharing the
Absolutely.
same story. We're trying to help each other.
Yeah.
I mean, I guess with any company, there's always a for-profit motive. But the thing is that as long as the healthcare focus and healthcare narrative is the priority, I think it can be an equal balance. And I'm hoping that in the future shows we do together, as well as in the coming year, when Hilton is more involved, I will be able to emphasize how I've been frank about health and how I've been advocating it for everyone who's listening, so that they can also learn more within the Hilton group itself, because they're interested in communicating the story. They just don't have at the moment. They don't have the right channel to do so.
Well, it
And
sounds like you came on board at just the right time.
yes, I do think two major things. The COVID pandemic itself, it just fueled me. And Sam Leibowitz, whether you're listening to the show or not, doesn't matter. If it wasn't for his Conscious Consultant Hour and for also taking me on, now I think that's 8 years ago, when I was just talking about epilepsy for 3 months, um, he welcomed me back so that I can further that message, especially about COVID and about Hilton and about everything else that we've been doing for the last 2 years. I'm just going to continue to fight for that mission, but also give back to the Talk Radio NYC family, as well as all of the guests that have been, like yourself included, all of the guests that have been on the show that I'm still in relationships and discussions with about future shows, and just being able to be another community for those out there that are looking for help.
Yeah.
You know?
Yeah. Now, let me ask you, Frank, are you open to hearing from listeners as to what they would like to hear on the show?
Absolutely. I'm working with a company that is looking at all my websites and social media and trying to siphon uh, shows that we've done on a playlist and play them out there to get engagement and to do surveys of those kinds of topics they'd like to hear about. I keep giving my email address, frankrharrison1@gmail.com, but I get very limited response. I would say that once this company, I'm leaving their nameless for now because we're still in talks. Once they access the catalog more readily, they will go out through other channels besides the ones that TalkRadio.ny hosts and drive that interactive traffic in. I know currently on our YouTube channel and on our LinkedIn channel, people can type in their comments, and even Twitch. I know Logan behind the scenes has been able to communicate with Twitch members, and they've been asking questions live on air. So I would like more of that in the coming year. That is my intention. I really hope that happens.
Wonderful.
Oh, wait. I think we're headed for another break. Okay. When we return, we just started to, but we will continue to talk about the future of Frank About Health, as well as our future episodes that we will be having in the coming weeks, and other things that, Karen, you may want to give insight into. And we'll just be back in a few. So stay tuned.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Broncu, host of The Hard Skills on TalkRadio.ny at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on TalkRadio.ny.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on TalkRadio.ny, I host the program Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on TalkRadio.ny.
Are you a business owner? Do you want to be a business owner? Do you work with business owners? Hi, I'm Stephen Fry, your small and medium-sized business or SMB guy, and I'm the host of the new show, Always Friday. While I love to have fun on my show, we take those Friday feelings of freedom and clarity to discuss popular topics on the minds of SMBs today. Please join me and my various special guests on Friday at 11 a.m. on TalkRadio.ny.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Hey, everybody, and welcome back. All the talk that we just had, Karen, about what I'm hoping to get in terms of audience interaction just got me going to, during the last break, sharing my website, giving everyone a tour. Remember, everyone, it's www.frankrharrison.com, and it's going to be expanded even further with all the shows that we're doing, including tonight's. And more importantly, I definitely want this year to be more interactive, more engaging. Aside from doing shows at Hilton, I want to be live in the room with the person, like we're going to be in February. I also know that in the coming weeks, I'm going to be involved in a side project that is going to allow me to meet most of the guests that have been on the show over the past 2 years, but we've been doing it through Zoom. So it's like I'm going to be meeting everybody for the first time in person. That should be a thrill. And I think, if anything, I'm just looking forward, especially to the next 3 shows that we're going to be doing. One of them is, as I mentioned earlier, a Stage of Epilepsy show about a woman with an epilepsy podcast. I think that should be interesting. In 2 weeks from there, I will be having someone from Hilton. I'm looking forward to that. That would be my first. I've tried that before, but it didn't work out. Now we're already discussing terms of discussion, and that makes me feel good. And then finally, we're going to have a very interesting show, which I know, Karen, you're going to be involved in helping us produce, where we are talking about dissociative identity disorder. And it's going to be a case study of someone within the TalkRadio.nyc family, but I'm leaving that anonymous for now. But it should be a definite, I don't want to use the word game changer, but an eye opener. Because, I mean, what I love about this person's case is that, for anyone who knows what DID is, the traditional name was multiple personality disorder, a whole life of various alters. This person is friends with his alters. I mean, he's integrated and he knows what's going on when they take over. I love this story. So I'm hoping it's going to have the same kind of impact when it gets seen at the end of January. But more importantly, what I even like is that in preparing the show, your involvement in helping with the medical community's credibility factors, so the research knowledge, the experience in working with patients who had similar cases, that's going to be tantamount to enhancing the value of that particular show. Because, again, not being a doctor, it would not be giving a committed story for this person who will be the guest. So I'm very grateful to you already in advance for what you will be doing to help us get a professional to really comment on the disorder and what people can learn about it in terms of treatment or options or even hypnosis if that's
Absolutely. Yeah. No, I'm talking to psychologists and psychiatrists who have that as a specialty. And our goal will be to have one of those professionals on the show. And so that I love what you're going to be presenting with the individual who is living that condition, that life. And then
Yes.
to be able to talk to a professional who works with others. And I'm sure that it has to be approached from different angles. And
Absolutely.
and a professional will be able to tell us what that looks like. And I think what the other thing they might be or will be able to bring to the table is, how do you identify this in someone you know or love? Maybe you're seeing some signs that something's just not quite right. Um, Maybe we'll get some guidance as to whether or not that could be an issue and what might be the next positive step to take for everyone concerned.
Correct. It's gonna. I'm amazed in the fact that it's a show that I'm involved in, of course, and you're involved in. But I'm gonna be more mainly an audience member, learning.
Well, so will
I
I. So will I.
that
Absolutely.
is gonna be profound. And then, of
Yeah.
course, the week after that will be our show together in Chicago, where Aretha Gray will join us. She already confirmed that last night, and we will talk about Heart Health Awareness Month, as well as all the subheadings that you outlined. But she even said she has things that she wants people to know, especially in the area of women who have symptoms that are not like what men have. In
Right.
fact, last year, which I don't know if I had shared with you, when she was on the show last year, she was supposed to be the first guest that first week, but she was going to the hospital thinking she had a heart attack, and it turned out it was not heart related.
Wow.
Yeah. But we had learned a lot from her experience in addition to the 3 episodes that we put together. But I think having one nice, robust episode with you the first Thursday in February is going to be very interesting, and I'm looking forward to that as well.
Oh, me too. Me too. Um, if I could, how much time do we have? Do we have a little bit of time?
Uh, right now, I think I haven't gotten the closing alert yet. Let
Okay.
me see. No, I think we're still good. What would you like to
Okay.
share?
It occurred to me that I hadn't told any stories about hypnosis. I've talked about how great it can be, but I think people like to hear stories. So I'll tell a real quick one if that's all right.
Sure, sure.
Had a client who just decided years ago she didn't want to drive anymore. She wasn't comfortable driving. It put her in kind of a state of fear. And she and her husband both retired, so he drove every place. It wasn't an issue. Well, he took a fall from his bicycle and really messed up both of his hands, and he couldn't drive. So
Oh, wow.
she was put in a position where she had to start driving again. She was terrified. I mean, she was going to have to drive him to the doctor. She was going to have to drive to the grocery, whatever they needed to do. She had to start driving again. And she was just gripped with fear. And
Wow.
I was able to work with her through hypnosis and then develop a recording. You mentioned that I give people customized recordings. Gave her a
Yes.
recording. She just said, "Oh my God." She said, "That's exactly what I needed to hear." And this took place maybe 3-4 months ago that her husband had the accident. She's been driving comfortably, easily. It truly was a game changer. So that's an example where somebody can bring something that's a little bit different to the table. And we can turn that around for an individual.
Wow. I mean, I definitely want to again feature an entire show in the coming year on hypnotherapy of other successful cases than the ones you've mentioned. Like, and maybe it'll be possible if that client is willing to share their story on air, unless they
Oh,
want to
that's a
keep things
possibility.
this. Well,
I hadn't
that would be
thought
so
of that.
interesting.
Yeah. Yeah.
And either way, I'm just letting, like, I liked what you asked me earlier about getting involvement and engagement from audience members to ask for the shows that they would like to have on. You
Mhm.
know, I've been fortunate to work with not just NYU Langone Health, but also with my various guests of the past that have referred guests. Phyllis Quinlan comes to mind. Also, we have mutual relations with Maury Zelkovich and Evan Messman, and not to mention you and I. So I know that they will come back as well. And who knows, maybe they'll even have more discussions on AI, which is what I also want to get involved in the coming year. But I'm also getting the alerts about the coming end of the show. So that all
Okay.
being said, I hope everyone out there had a chance to hear a summary and a review of what was going to happen in the next 12 months, as well as how I'm doing my best to change the nature of the show to be more proactive for all of you out there. Karen is adding a tremendous value with her experience in having been a radio show host, and Hilton's involvement is amazing. I am just looking forward to all of you actually responding to my websites or my social media. Or if you hear this show as a recording, please email me at frankrharrison1@gmail.com. I'm actually here to engage with beyond the show for any advice or research or resources that you may be looking for, or if you want to be a guest on the show. So I'm completely open to that. I want to thank again both Logan behind the scenes for engineering this show. At the same time, I want to thank you, Sam. Again, I always will. And I also like your myriad of shows that you replayed, including the 100th episode that I did with Karen this afternoon. So thank you for that. I'm going to announce tomorrow's slate of shows right here on TalkRadio.nyc. The first one is Always Friday with Steve Fry, Philanthropy in Focus with Tommy D. Then Always Friday with Steve Fry, ending with Intangify. And then Tuesday, we have The Hard Skills with Dr. Mira Branco. And next week, after the Conscious Consultant Hour with Sam Leibowitz, will be Frank About Health with me and Jeff Dimitrek as we look at a stage of epilepsy. All right, ladies and gentlemen, thank you for listening to today's show right here on talkradio.nyc and on all of our socials. We'll be back next week. And I guess, Karen, thank you again. And we'll definitely be in touch almost immediately.
Well, and
right.
thank you, Frank.
Oh,
Love
you're very
working with
welcome.
you. Great.
And for everyone out there, Happy New Year and welcome to 2024.
Yep.
Make it a
Happy
healthy
New
one.
Year.
All righty. Bye-bye.